Hi all, welcome to OET Speaking and Writing. Please read this card. You have 2 minutes for the preparation. Here the setting is ER observation room. Here we can start our conversation by saying, "Good morning. My name is Sarah, your attending nurse today. Well, I've seen your case notes, and may I confirm your name please?" In this way, you can ask the name of patient. Then we can tell the patient like, "All right Miss Maria, the doctor has asked me to insert a small needle in your arm, so that we can start giving you some medications. Do you think is going to be okay?" Probably the patient may not agree with you. She may tell you like, "I've got a huge fear of needles, and I don't feel comfortable." Then we need to address the concern and reassure the patient. So you can tell like, "Well, I understand your concern and this is quite common concern. It's not unusual for you to think like that. I know you are scared of needles, but let me explain that in your case, we need this intravenous injection rather than oral medications because you need an immediate treatment for your infection. Intravenous route is the best way we can resolve this issue. Are you following me? Now, our first task finished. That is, we informed about the necessity of IV calculation. Sometimes patient may express her fears about cannulation. Then we can just tell the patient like, "Miss Maria, this is a small procedure. It's not going to harm you. It is just like a plastic tube. Once the needle is in, we will take the needle out, and we'll just fix the plastic tube in place. Is that okay?" And I've seen many patients like this, and they are absolutely fine with this. So, can I go ahead, please? Probably, as per their interlocutor's card, she may ask about needle infection. Then we need to reassure the patient by saying, "All right Miss Maria, I understand you. And I quite agree with you to an extent that these needles can cause infection. But let me tell you, in this hospital we follow strict infection control procedures. So we'll make sure that we follow all the aseptic procedures and the needle is inserted, probably by proper trained staff. And we'll check the needles on a regular basis, like we'll check it 3 times a day to make sure that you are infection-free. And if we have noticed any signs of infection, we'll soon take it out. You don't have to be scared of this, and I can assure you that this is completely going to be fine. Can I go ahead?" Sometimes patient may ask you discharge. Then as per our last task, we need to explain about the importance of hospital stay. So you can tell like, "Miss Maria, I know what you mean, but let me tell you that your condition is not good. How much do you know about your condition?" This question you can ask in between. After that you can tell like, "I'm so sorry to say that your life is in danger. So it's really important for you to start this IV medications. It's your decision. But I would strongly suggest you to stay here and get the emergency treatment done, and then you can go home. So please can you consider my request to have this needle?" Now the patient may agree with you. Then you can tell like, "All right Miss Maria, I am so pleased with this decision. Thank you so much for considering my request, and we'll start with this immediately. I will come back soon with all arrangements for your cannulation, and I wish you a speedy recovery." In this way you can end up your conversation.